Well, before I hand over to our leadership panel, I do want to share a few logistics announcements. We invite you to explore the agenda on the platform, read the session resources and descriptions, and RSVP to add them to your calendars. Remember to click on the link for every session to join in. The main language of the conference is English, but you can listen to the plenary session in French or Spanish by clicking on the main stage buttons in your preferred language. You can also enter English, Francais, or Espanol into the search bar at the top of the agenda page to see the plenary schedule and the sessions that will be offered in your preferred language. We recommend you join the parallel sessions using the Zoom app to use the full functionality and interpretation features during the breakout sessions. And just a friendly reminder to refer to the event's code of conduct available on the website to ensure respectful, inclusive participation for all of us today. If you want to find out more about equity, COVID-19, and women's, children's, and adolescents' health, you can click on the resources link in the website. There you'll find a variety of resources, such as the COVID-19 digital toolkits, the self-care video series, and the compendium of partners' resources showcasing up-to-date and trustworthy material to help inform you on key topics, including pregnancy and COVID-19 or adolescent mental health. Now, without further ado, let me introduce our first panel. Our first panel exemplifies the leadership to promote equity-enhancing responses to COVID-19. We have assembled a fantastic set of global leaders driving efforts to achieve equity to share their experiences with you. This panel conversation will be moderated by the Right Honorable Helen Clark, Board Chair of PMNCH and former Prime Minister of New Zealand. Welcome, Helen. It is a pleasure to see you back on this stage today for our third leadership dialogue.
Thank you, Alana, for that introduction. And big thanks also to Elif. What a wonderful testimony that was to start off our day as well. Great to be back at a Lives in the Balance Summit, number 3, and to everyone connecting from all around the world, on behalf of PMNCH and the co-hosts, can I personally welcome you to the online summit. Of course, those of us on this virtual stage for the summit are fortunate to have access to the technology and the infrastructure which can bring us together to reflect and to share on how the world can build back better and move forward fairer in recovering from the horrible impact of COVID-19. It's sobering to note, though, that still around half the world's population lacks an internet connection and couldn't join us today if it wanted to. One of many equity issues in our world. Just before the number 2 Lives in the Balance Summit was convened last December, the news was received that Pfizer had the world's first COVID-19 vaccine ready for rollout. And it wasn't much later that a grandmother in the United Kingdom by the name of Margaret Keenan became the first person in the world to be vaccinated. That kicked off what stands to be the largest mass vaccination program our world has ever seen. But it's also one that's characterized by inequitable access. High-income countries, accounting for around 18% of the world's population, have bought some 4.6 billion doses of vaccines, which represents 60% of all the confirmed orders. But as you heard Alana say today, to date, only 2% of the total number of vaccinations actually administered have been administered in Africa. And this geographic inequity puts at particular risk populations in the world's low and middle income countries where the greatest number of maternal, child, and adolescent deaths occur. This very simple truth is this: none of us will be safe from COVID until we are all safe. it is so urgent now to scale up the production and distribution of vaccines so that all around the world communities have access to them. So let me come now to the panel joining us today. Prime Minister Mia Mottley of Barbados, Wendy Morton, Minister at the UK's Foreign, Commonwealth and Development Office, Awa Marie Cole Seck, State Minister for the Presidency in Senegal, Jennifer Klein, Executive Director of the White House Gender Policy Council, United States, and Najish Karim, Provincial Trainer from Pakistan. And thank you to you all for agreeing to take part. First, let's roll a video from Prime Minister Mia Mottley of Barbados. We asked Mia what, in her opinion, the global community should be doing to mitigate the impact of COVID-19 on the most vulnerable. And here's what Mia said. Video, please.
Hello, distinguished guests all. I've been waiting for some time to participate in a summit with this name. Lives in the balance, yes. Equity in COVID-19 recovery. It's been a wish for all of us who come from small island developing states. And why? The COVID pandemic has disproportionately affected low-income countries and small island developing states. It has also affected middle-income countries in which 70% of the world's poor people live. And we therefore are confronted by the reality of inequities with respect to access to medical technologies, laboratory services, essential medicines, and vaccines. At a country level, there have been further disparities wherein the elderly, our women, our children, our adolescents are not necessarily receiving the same social protection and economic support to weather the ravages of the pandemic. It is essential that we create national, regional, and international strategies to support the most vulnerable among us so that no one is left behind. This, my friends, requires a whole of society approach that is enhanced by the contributions of civil society and NGOs, the private sector, religious and cultural groupings, everyone coming together with a single mission. Of particular concern to my country, Barbados, is access to vaccines and other therapeutic agents, which are skewed away from the economically disenfranchised, and which even for those of us who are middle-income countries, we have been denied access by the use of crude proxies, such as whether we have certain levels of maternal mortality. Nothing at all to do with the reality of the risk to COVID. We therefore face a double burden, wherein there is less access to countries such as ours, who in turn have specific vulnerable populations with specific needs. Countries need to set aside a number of resources for their vulnerable groups and key populations. And we want to do so, but we have to have not just access to concessional funding, but we equally have to have access to the fiscal space even when the funding is available. These are not normal times, and therefore, as we seek to develop tailored social interventions that reach people in communities where they live, we need to have the resources, because without life we have nothing. And therefore, our primary responsibility is to keep people's heads above water. In keeping with the tenets of the Sustainable Development Goals, we therefore call on all countries to ensure that universal coverage and access to healthcare is extended to our most vulnerable populations. We support and enhance political commitment at a global stage level to address these disparities. Indeed, only recently I've had cause to call a number of times this week for an urgent global summit that addresses many of these issues. The only path to mitigating this pandemic is through global leadership and global political commitment. We are not yet out of the woods. And for those who believe that that horse has already bolted the stables, I say it is not so. For each week we continue to hear that this virus is affecting more and more and more people globally. There is never a time that is too late to do the right thing. This forum, supported by Partnership for Maternal, Newborn and Child Health, the Core Group, the Global Financing Facility, and Gavi, the Vaccine Alliance, is a critical step in the direction towards the kind of global summit that I want to see. And we thank you for bringing this meeting together. Barbados remains indebted to the global work and leadership of Gavi and to its philanthropic partners, and we would like to pledge now our continued support for global action and leadership in this fight, and we pray that our collective deliberations and determinations will bring the leaders of this world closer to recognizing that we need to meet and meet urgently to solve this world's problems in 2021. Thank you.
Amazing words from Prime Minister Mia Mottley. Without life, we have nothing. And calling for a global leadership and political commitment to beat this pandemic. The Independent Panel for Pandemic Preparedness and Response, which I've been chairing the past 10 months, has just issued a report calling for exactly that, a special session of the General Assembly to endorse a reform program which would include having a Global Health Threats Council at leadership level. And I really hope we can get that special session, and I hope to see Prime Minister Mia Mottley very prominent at it in her call for an equitable approach to addressing this pandemic and averting future threats. Next, we asked the Honourable Wendy Morton, the Minister at the UK Foreign, Commonwealth and Development Office, to share her views on how global leaders could ensure that equity is advanced in the COVID-19 response and on how progress on women's, children's and adolescents' health can be preserved. So let's now see the video from Wendy Morton.
Thank you, Helen, for such a vital question. As we know, and sadly, if not unpredictably, the impact of COVID-19 on women, adolescents and children has been disproportionate and it has been profound. We also know that no country has been spared, so the only rational way forward is a way we find together. As global leaders, we have to advocate in the strongest possible terms for gender equality and for the needs of women and children to be at the heart of our efforts to rebuild. And that doesn't mean going back to where we were, because where we were had its own problems. We need to show vision, and as well as leadership, and to rebuild in ways that challenge and overcome the systemic reasons for inequality. Success will be a recovery that leaves no one behind. When leaders unite, we can give a voice to those who have gone unheard. Earlier this month, under the UK's G7 presidency, foreign and development ministers from around the world got behind an agenda that put women and girls at its core. And I'll give you two examples. First, we agreed an unwavering commitment to defend and protect sexual and reproductive health and rights for all. We know this is a critical step in ending preventable deaths of mothers, newborns and children, keeping girls in education and achieving universal health coverage. Second, we confirmed our commitment to rapid, equitable and affordable access to COVID-19 vaccines, therapeutics and diagnostics, including by strengthening wider health systems. Women have been at the forefront of the pandemic response, and we see more clearly than ever that women are the backbone of the global health workforce. Their access to vaccines and essential services is critical for the health of the whole population. 2021 is giving us many opportunities to step up our game and to build resilient, responsive and inclusive systems for the future. Next month's Generation Equality Forum in Paris and COP26 in Glasgow in November are chances to change the global mindset on inclusive development and the rights and participation of women. With smart, compassionate leadership and a will to work together, we can step into a brighter, healthier future for women, girls, children and adolescents everywhere.
And thanks so much to Minister Wendy Morton for her commitment to advancing equity for women, children and adolescent health. So let's now come to our panellists who are very much live and alive for our session this afternoon. And I was going to start with a question to Jennifer Klein, from the White House Gender Policy Council. Jen, as we speak of how equity can be advanced to improve the health of women, children, and adolescents, we acknowledge that the United States itself is facing some significant ethnicity-based disparities in maternal mortality and in COVID-19 mortality. Addressing those disparities has recently been announced as a priority of the Vice President of the United States, Kamala Harris. Would you be able to tell us a bit more about the administration's strategy for addressing such inequities and their health outcomes? Over to you, Jennifer.
Thank you. And thank you for having me and the representation of the Gender Policy Council. I'll start by saying that the first step to addressing the inequities that we have right here in the United States, I think, is the signal that the administration sent by creating this council, which is about focusing on gender equality and gender equity, and also ensuring that gender equity is really embedded in all of the work that we are doing. So when I talk about our work on maternal health and ending maternal mortality here in the United States, it's just an example of the kind of work that that we are doing under the leadership of this president. And I also think, what we've already seen or heard from the amazing contributions so far is how the issues that we are facing here are completely consistent with the issues that are being faced around the world. I mean, I think that you've heard already about the concern about equity, both within countries and among countries. And I think that's what we all need to keep front and center as we try to tackle the COVID crisis. The health crisis, the economic crisis, et cetera. But turning, as you said, to our particular strategy on maternal health, America's maternal mortality rates are among the highest in the developed world, and they're especially high among Black and Native American mothers who die from complications related to pregnancy at roughly 2 to 3 times the rate of white, Hispanic, Asian American, and Pacific Islander women. And that is regardless of income level or education level. So we are committed to addressing these unacceptable disparities and really to build a health system here in the United States that delivers equity and also dignity to Black, Indigenous, and other women and girls of color. And that actually extends to our foreign assistance and development assistance as well, this sort of focus on equity and health. I would say there's sort of 5 important levers that we are employing to actually address this crisis right here at home. The first is health access and equity. So as President Biden has said so poignantly for so long, healthcare is a right, not a privilege. That is true in so many countries around the world, and it has not always been true in ours. And so the first thing we need to do is ensure that all women have equitable access to healthcare, both before, during, and after pregnancy. And what we know is that women of color in the United States are more likely to lose coverage during or shortly after pregnancy. And they're also less likely to have access to mental health supports following childbirth. So as we fight to bring an end to COVID, we'll also continue to make sure that quality healthcare is more accessible and affordable for all Americans. The second is implicit bias training. We need to address implicit bias in care and focus on provider trainings to reduce missed or delayed diagnoses, implement a maternal health early warning system, improve communication and handoff between obstetric and other types of providers, and expand clinical office hours and the number of providers who accept Medicaid. The American Rescue Plan, which was passed in March, included $30 million for implicit bias training for healthcare providers. And we know that the training that we need should extend beyond implicit bias to really address the structural barriers, the systemic barriers that women have faced accessing care in this country. The third is community-based services. We really need to invest in community-based organizations to help reduce the glaring racial and ethnic disparities that persist in our healthcare system. So while we know that the medical sector is highly resourced, there's no payment model here for social interventions that dramatically reduce the risk associated with pregnancy and childbirth. There's no place in our healthcare system for doulas or perinatal community health workers. Health insurance doesn't cover things like stable housing or nutrition or even time off from work to attend to your own health or to other supports. And so we're looking at some innovative payment models to actually create flexibility in maternity care. Things like home visiting during and after pregnancy. Which the U.S. has historically not had for postpartum women and newborns. And while the ACA, the Affordable Care Act, expanded these programs, we need to expand them further so that we meet the medical and social needs of pregnant women in a respectful and culturally appropriate manner. Fourth, we need to diversify the workforce. So we know that given the disproportionate burden of maternal mortality on Black and Indigenous women, we should expand the number of Black and Indigenous OBGYN, nurses, midwives, and perinatal community health workers and doulas. And that includes investing in recruitment and training. Employers, insurance, and our Medicaid program should ensure that group perinatal care and prenatal care and community-based models of care, including midwives, birth centers, doulas, and perinatal community health workers, are available to their enrollees. And then last, not always obvious, but really important, is data. We need to improve how and the amount of data that we collect to better understand the causes of maternal death and complications from birth. Our discretionary budget invests dollars in bolstering these maternal mortality review committees in states around the country, which are important drivers of data collection that will help to close those disparities. So in total, we think that these 5 steps will really make a difference, an investment in maternal care, in working to strengthen the levers to ensure that we are centering and advancing equity in our healthcare efforts more broadly.
Thank you so much for that, setting out that very comprehensive strategy to advance equity. Very, very impressive, and we really commend you with it and wish you all the best with implementation. Let's switch now to another continent, and that is to Africa and to Minister Awa Marie Coll Seck of Senegal. Awa Marie, we've been hearing from many about the need for a gendered response to COVID-19, recognising the special needs of women and girls. And we also note that women constitute a large majority of the health and social care workforce. Based on how Senegal's been handling the crisis, what recommendations would you have for others, including development partners, on how to ensure that responses to COVID-19 are gender responsive? And in your opinion, what are some of the barriers to getting that? Over to you, Awa Marie.
Thank you, Ellen. And thank you to all the organizers. I can say that we have learned from several epidemics, but particularly from Ebola and also COVID-19, some lessons. And I would like to share with you, based on that, some advices I think we can give to the countries and the developing partners. Let me first of all say that countries and development partners need to elaborate a COVID-19 gender response framework or plan with clear indicators adapted to country specificity. This will highlight women participation in COVID-19 decision-making process, but also national policy measures, particularly those addressing women's economic and social security. A monitoring system, gender sensitive, will guide policymakers, but also advocates. Second, before maybe I can say also that we need to ensure that the framework and the plan are financed by in-country, but also by partners outside of the country. Second, the government and the partners did also to invest in sex disaggregated data to ensure that the impact of the epidemic differentiated by gender are identified and effectively managed. There are large gaps on gender data. Some barriers has been identified, and I can say that in fact we didn't have enough investment in collecting data statistics. This is the first one. It is not finance, but also data collection on issues facing women and girls are irregular. It is not always that we have data on that, but also the knowledge gap exists for new and emerging issues. Third, government to engage actionable policy measures such as expansion of social protection coverage, waiving of cash transfer conditionalities, direct cash transfer, but also adaptation of existing services for survivors of gender-based violence. Several countries like Morocco, Georgia, Rwanda, or Senegal have made progress in this direction. For these initiatives, government and their partners need to make sure that the more vulnerable are effectively reached. Here again, we can highlight some barriers like lack of reliable data, but also weak planification. And another point I would like to highlight is the issue of corruption, because sometimes if you are looking at food distribution and this type of things, you can have corruption and the people have no access to what was planned. Fourth, intervention and prevention services for violence against women and girls should be managed as essential services, should be also funded accordingly, and be an integral part of the national and local response plan when we look at COVID-19. We have there also some barriers identified, but these are more social pressures. The women are often not going to complain because of social pressure, but also they are not able to reach some structures who are taking care of that. Fifth, women are at the front foot of all public health crises, as nurses, as doctors, as midwives, community health workers, but we know that their role is frequently overlooked and underpaid. This is also something we need to know. Women and girls also tend to carry out most of the care in the house, but also do the work there and take care of the child. This is a lot of responsibility. Authorities must provide adequate social and psychological, but also economical support. Six, we need to maintain core health and education services and systems. Effort to contain outbreaks often interrupt education services, which is often devastating as devastating effects when we look at girls. It is important to know also that in the health system, often the resources are diverted from routine health services, including maternal and child health, but also adolescent health in general, but also reproductive health, HIV programs in particular. These potentially increase morbidity, mortality, transmission of HIV/AIDS, unwanted pregnancies, and early marriage. Often when the schools are closed, we see that the girls are sometimes not coming back to school when it is open. The case has been documented in South Africa, but also in Mozambique. We have a lot of information on that. We must ensure the continuity of core and quality education and health services, including alternative delivery structure. Notably, we can use IT, internet, a lot of things can be used to help to avoid to have this disturbance we see in education and in the health service. I would like just to stop there because I have a lot of other advisors that I want to focus on these 6, and I hope that this will be helpful for people who are taking care of gender approach when we look at the COVID-19 pandemic. Thank you so much.
Thank you, and definitely many very important pointers there to how to actually apply a gendered approach. Thank you so much. Let's come now to Nazish Karim. And to Nazish, it's clear that greater investment in training and support for frontline health workers, including our midwives and nurses, is just so important for improving coverage and access to quality services and for getting respectful care and the equitable and affordable rollout of vaccines. You work with communities in Pakistan to provide training and enhance capacity, particularly for women working in frontline primary health care. What have you learned from the women with whom you are working with respects to the steps we must take now to strengthen our health systems? Over to you, Nazish.
Thank you for giving me the chance to share my experiences on this international platform. I'm Nazish Karim, as a health activist and trainer in PEI program in Pakistan. Through Pakistan is a developing country and is struggling to enhance the basic health system. However, the COVID-19 was the best learning for all of us at that time. The services associated with the basic health and partially approachable due to the lockdown and fear of the COVID affected. This was widely decreases the end of users avail their essential immunization and the critical vaccinations as well. In the early stages, COVID-19 resulted in the increased number of zero doses child defaulters and the women who missed their TT injections and antenatal care as well. Community trust was already lacking before the COVID on this immunization in PEI and EPI services, while the COVID-19 boosted the remaining mistrust due to the witness of government unsafe environment in our health facilities, followed by the negligence towards the covert SOPs and misleading information sharing by the health practitioners. So what we do at that time, we involve all our health staff in the awareness sessions, of the COVID in community. And we record those data and make a mechanism system and recorded all the data as the people were reluctant to perform their COVID-19 test, despite having the symptoms. So that was our best learning at that time, that we can use our frontline workers for the plenty of things. That this is the time we learned that we all work as in one team. Still myths and misleading information on social media and words from mouth and from health practitioners and leads mistrust of vaccine within the community. Still, we are facing these kinds of problems in our community as well. What best solution we are working on, that our health workers are giving them the accurate information to minimize the risk, but we are still a long way to go for in this pandemic as well. Here I am giving the suggestion that all our health staff should be vaccinated for the COVID-19 vaccine with a proper check and balance and accountability from the affiliated government departments, private hospitals, institutes, organizations, to maximize the community trust in vaccine safety, efficiency, and benefits. Being a responsible citizen, we all individuals associated with providing health services, especially the health Services providers should be promote that the slogan vaccine works for all. As a frontline worker, we always followed as respected, and we are the role model in our community. So if we all are vaccinated and we are the role models, so that would be really helpful for the community to believe us, to believe on the vaccines, and vaccines works for all. So here I'm suggesting for the government departments as well. So they have a very strong accountability system. They need to be very strong accountability systems in their departments as well. Government to strengthen government health system through the capacity building in our EPI health staff, and we need an exceptional performance monitoring and accountability system at all levels. In our remote areas, we need well-trained gynecologists and female doctors should be deployed, and nutrition services should be provided. As our last panelist, they were talking about that there are plenty of in remote areas we have lack of primary health systems, and we have lack of well-trained doctors as well. Female doctors should be deployed, and nutritional services should be provided to the pregnant, lactating women and malnourished children, more specifically in the rural, remote areas as compared to the urban areas. The second one, ensure the flexible, easy access delivery related to the children and women in terms of integrated services, irrespective of religion and race. The third one, here I'm suggesting that the introduction of feedback system in Pakistan, we saw plenty of online portals and other stuff, but they are not working properly. Introduction of feedback system, so everyone have the access of what they are seeing in the ground, or they can report it. That should be an online portal system with the proper monitoring and follow-up mechanism. The fourth one, the skilled health workers should be trained on enabling environment techniques before the deployment, along with the full technical aspects before the ensuring appropriate antigens availability. Health workers should be motivated through non-financial benefits or to performing their duties more constructively, as we are working as in one team, and this is our noble responsibility to think about and be motivated. We are working in health system, and health is a very noble cause that despite from the financial benefit, we don't think about the financial benefits. We should more constructively think about what we are doing and how we can bring the change in this community and for the world as well. All health system information should be digitalized for the record and the easy access for the decision making and analytical reviews or the policy making. Strong reproductive linkages development between the communities and health facilities at the grassroots level. This time for the globalization and digitalization, youth champs can be beneficial towards the strengthened health systems. As we all know from last 2 years, everyone is like more on the digital side, and everyone is using different platforms, and we all know how much digitalization is important. So we can strengthen them through the youth champs voices. Last but not the least, women are the backbone. We need to invest on this for our better future and for our better generation. Thank you.
Thank you so much for bringing that perspective from being on the front lines of training and support of our primary healthcare workers. Very, very valuable. And clearly the example being set that health workers vaccinating is a powerful message to everyone else is very important. Coming back now to Minister Awa Marie Cole-Seck. Awa Marie, we've been hearing of course, from our speakers about the importance of global solidarity. And we know there's a need for equitable vaccine rollout to combat COVID-19. As you know, there's been a movement for the suspension of patents on vaccine intellectual property in an attempt to accelerate and lower the costs of production and save more lives. I wonder what your perspective would be on the proposal. We know that the African Union and its members have long tried to promote local manufacturing of pharmaceuticals and now vaccines. What are your thoughts on this question and where the issue is moving?
Thank you, Ellen. Again, I would like to just tell you that I am more than happy to be able to speak on this topic. Most countries in Africa rely heavily on imports for pharmaceutical products, whether it is for pandemic diseases or for an overall range of products. The situation has economic implications regarding use of hard currencies, but also missed opportunity in terms of economic development and job and wealth creation, and threat for the sustainability of treatment programs. This is very important for us. It is why promoting a growing also of the industry on our continent is of strategic importance. But it is not only to have manufacture, because we know that a lot of research has done in the north, and also all the element of ownership is also there. We need to work with all the international organizations and countries to be able to waive some of these to ensure that we are doing all this in a legal framework. Also, Africa is approximately 1/4 of the global vaccine by volume. It's manufactured less than 1% of the routine vaccine. With almost out of yellow fever, no outbreak vaccine manufacturing in place. The launch of the African Continental Free Trade Area and other harmonization efforts by the African Medicine Agency and various regional organizations are steps in the right direction. But we need also to build a stronger environment for investment. It is why a lot of African banks are today joining force with the African Union, but also others from outside Africa, because this is important to have this solidarity. Thus far, only around 2% of the world vaccination against COVID-19 is taken place in Africa. You have said it, the national list of the most healthy countries is another wake-up call. We cannot wait always to have this type of situation to really mobilize our energy. And this is very important to do that now. I appeal for a rapid ratification of the treaty we have concerning the African manufacture by the Union, the African Union member states, because this has been already this phase through in 2019, and until now we have only 6 countries who have signed the treaty. It is why I really appeal for that, to be able to go now there to implementation, and not only to have all written on paper, but not doing that in fact. And the African Union seems really to be very engaged on that, and they have the support of all the people who want things to change in Africa. We have technical people able to do that, but we need to have all the support of the international community. We have no more time to lose. Thank you.
Thank you so much, Awa Marie, and indeed it would help enormously to expand production of vaccines and therapeutics in general in Africa, where the need is so high. Let's come back now to Nazish, who works with women at the intersection of youth, poverty, gender, and ethnicity, among other factors. Nazish, what advice do you have for us and our audience on how programming can best capture the specific needs of women, children, and adolescents at those intersections?
Thank you so much. I think that we need to inject more and more skilled local women in our health system, as the still community can't avail the basic services due to mistrust and unavailability of critical health staff within health facilities, are not in field and paying less attention to their assigned duties. In remote areas, we have 90% of male frontline workers. And due to cultural barrier and tradition and norms, women are reluctant to avail their health-related services and advise towards creating a healthy environment and ensuring immunization in terms of integrated services. As I mentioned in my first question as answer as well, that women are the backbone. We need to think about the gender sensitivity as well and the area sensitivity as well. Women cannot easily share their problems to the male frontline workers. Second one, health-related outreach activities should be the burden to ensure ease of services availing and trust building between the communities at large. The third one, I think that the young health workers should be deployed to perform duties at health centers for the result-driven activities. Here I'm quoting age matters idea, that the combination of two members, one should be a younger one and another should be the older one, for our door-to-door campaign awareness and quality service delivery beside the team should be provided with the advanced basic instruments. While at the field level, I think that need young one, energetic and motivated frontline workers. Besides, for the influencer, old age frontline workers are the ideal, keeping in view their extensive experience, expertise will be ensure the benefit of our programs in our longer run, and can play a very vital role for its sustainability. So the idea for the young task force and for the older one, so that the mixture for the blend, it will be really helpful for the sustainability, and we can achieve our goals what we are thinking right now to achieve it. The third one, a conducive and friendly environment shall be provided to end users at all levels. We need to create huge giant groups, and we need to involve them for the greater cause. Youth they are energetic. They can bring change. Everyone knows that they can bring change, so they can help us for the greater cause. For this greater cause, a concrete and cohesive health delivery services activities should be chalked within involvement of ownership of our local government. It's really important that it should be chalked within the involvement of ownership, the local government and ownership. Communities, stakeholders, influencers, and notable religious leaders to increase our coverages. Delegation of authority shall be ensured at grassroots level with a strict accountability mechanism, and one team approach for this noble cause should be encouraged. If we accept we all are global citizens, coexisting with an ever-increasing global crisis of stark inequality, inhumanity, and suffering, then we must acknowledge the real solution can only come by the active global citizenship. We cannot bring change with the money. We can bring change by the awareness, right information sharing, encouraging rights to service, and closely work on the community behavior. Here, on our high-ups and international community, emphasize government to think about not only policy, but concentrate implementation with a proper accountability mechanism for the better outcomes. As one of our panelists mentioned, I think Miss Wendy Morton said that the collective collaboration needed. So I agree, and I'm agreeing this that through the collective collaboration, we can achieve our global health goals. So let's work together. Thank you.
Thank you so much. And let's come back to Jennifer Klein at the White House. Noting that the United States offers such a compelling example of how important leadership is in combating the COVID-19 pandemic, or not combating it as we saw. But this year, we're watching the United States making extraordinary progress and rolling out vaccines to its populations. How can we also encourage, Jen, and promote continued development assistance for health when the economies of the development partners have been so badly hit, and yet the needs are so great to get those vaccines and other tools out there?
That is the right question, isn't it? I think you've actually heard the answer loud and clear in some of the answers of the prior panelists, which is that, and the panelists that came right before me said it, we are all global citizens, and this is about global solidarity. A number of people have used those words. And as my former boss, Secretary Hillary Clinton, has said many times, it's not only the right thing to do, but it's the smart thing to do. If we didn't know before how deeply connected and small the world is, we certainly know it post-COVID. So we are literally intertwined. And if that's not, enough to convince even the doubters, I don't know what is. And the issues are intertwined. I think, the other thing that I have been laser focused on since taking on this role at the council is that, you can't deal with health alone. These issues are completely intertwined, and they literally don't stop at borders, which again is why the council that I am heading is focused both on global and domestic issues, because they are inseparable. And we think about, I would say that the top three priorities that we are focusing on at the moment are health, for all obvious reasons, and including sexual and reproductive health and rights, strengthening women's economic security and labor force participation, and responding and preventing all forms of gender-based violence. And of course, cutting across all of these priorities is the disproportionate impact that COVID has had on women and girls. This discussion comes as, again, we've heard so powerfully this morning for me, that this discussion is happening as we are watching the pandemic strain some of the world's best equipped public health systems, including our own here in the United States. And as the president has said to all of us inside the White House and outside, it is clear that we can only get through this if we do it together. No country in the world was prepared for this lethal pandemic. And as a result, more than 3 million people globally have died. And, in addition, as I said, it's not only the health consequences, but it's the devastating economic and social impacts here in the United States and around the globe, which has literally threatened decades of progress in poverty reduction and development. And that's why, again, the subject of this panel is the exact right question, which is why ensuring an equitable response to and recovery to the COVID-19 pandemic is at the top of our administration's priorities. And just to talk a little bit about some of the process we've put in place to actually assist in that global response. The administration stood up a Directorate for Development, Global Health, and Humanitarian Response right at the National Security Council. And this directorate right now is focused on building more resilient health systems around the world, especially in the wake of COVID, and addressing how the U.S. government can best support recovery efforts. in a way that advances development and addresses the pandemic's disproportionate impacts. We're actively promoting efforts to build back better, not just in the United States, but around the world. And as a result, we've provided billions of dollars to address the pandemic in more than 120 countries as part of the American Rescue Plan, which, as most people know, was the first the relief bill that the administration was able to pass in March. We've committed $11 billion for the global response. All of this, aiding this global response and recovery, is inextricably linked with other priorities, including advancing gender equality. No one will be safe until we're all safe, right? Uncontrolled global transmission risks the emergence of dangerous new variants. It poses risks to under-vaccinated populations in our own country, and it poses enormous dangers to countries with large unvaccinated populations. And this is why we are we feel strongly about taking on this leadership role. And, again, just to take one other example, it's why, while we believe in strong intellectual property protections, we support the waiver of those protections for COVID-19 vaccines in service of ending this pandemic. It's also important to recognize that the COVID-19 pandemic is not only a global health crisis, but it's also a humanitarian development and economic crisis. It's a caregiving crisis. I mean, we've seen this, and again, other panelists have spoken to this. We've seen this in the world's dependence on the essential workers, finally calling people who are caregivers essential workers, whether those are healthcare workers or the people who are taking care of children or older relatives. And in the disproportionate that women and girls have taken on in bearing unpaid caregiving responsibilities. Again, this has the potential to really set back gender equality, and that's why it needs all of these things need to be a focus as we think about recovery and relief. The ongoing social and economic disruption that has been caused by this pandemic could drive, 100 million or more people back into extreme poverty, particularly affecting women and girls. Women and girls have faced increased rates of gender-based violence. People have referred to that as the shadow pandemic. Disrupted access to sexual and reproductive health services, the loss of access to education, and disproportionate job loss and economic insecurity, even as women have, as I said, taken on additional caregiving responsibilities. So recognizing the gender and the racial disparities that COVID-19 has both magnified and exacerbated, President Biden has tasked us with formulating recommendations to address the effects of the pandemic and related disruption on women and girls in coordination with the White House Office on COVID Response, the National Security Council, and the COVID-19 Health Equity Task Force. But working to address the economic impacts of COVID on women and girls is literally a government-wide effort. We see our job as helping to support and coordinate that work and to ensure that the focus on women and on gender equality isn't siloed, but is actually infused throughout the work of our policies and our entire response.
Thanks so much, Jennifer, to you, to Awa Marie, and to Nazish for being live on the panel, and your contributions, together with those of Wendy Morton and Mia Motley, have all emphasized we're in this together. None of us are safe till all of us are safe. We've been living through a nightmare. We have to learn the lessons of what went wrong, how we can do better. We need gendered responses to this. Women really have been left in the lurch by insufficient provision being made for continuity of essential services like those in sexual and reproductive health. So some big issues and challenges here, but each of you in your way have shone a spotlight on them, and we're better informed as a result to go forward and endeavour to make a difference for women, children and adolescents. So thank you so much, and back to you, Ilana.